do they have hepatitis for the rest of their lives? Is this curable?
Well, in some cases, it's not curable because we know that there have been something like 400 cases globally and over 24 liver transplants, meaning that this hepatitis is so severe that it has caused many children's livers to completely burn out and they've required transplants. We've even had 5 deaths right here, and in the United States, we've had over 109 cases.
Pediatric hepatitis outbreak with mysterious origins is now growing as more states investigate cases of children developing the liver illness without a known cause. And now new research finds coronavirus might be linked to cases of severe hepatitis in our children. Dr. Frita Fisher is certified in pediatrics, nephrology, and internal medicine, and she joins us now. Good morning, Dr. Frita.
Good morning.
Good morning. So how do we know this is, or do we know, is this connected with COVID? Is it connected with the vaccine?
We do not know if it's connected to COVID, but there is a theory. We do know that it is not connected to the vaccine because most of the children who are falling ill are less than 10 years of age. The majority of them have not received a COVID-19 vaccine, and so we do not believe there's a connection. With COVID, yeah, there's a difference.
Sorry.
Yeah, we know that there's a connection with the adenovirus. Most of the cases of the viruses have been tested for adenovirus type 41. But there is a theory, and it was published in the Lancet Gastroenterology and Hepatology, a medical journal specializing in liver disease. And the theory is that some of these young children could have had COVID-19 and not known it, been asymptomatic. But the COVID could have primed their immune systems to be hyperreactive to adenovirus, leading to the severe hepatitis. That is very plausible.
How will we know if our children are affected with or infected with hepatitis? What are the signs?
You have to watch for vomiting, abdominal pain, dark urine, pale stools, and jaundice, which is when the eyes turn yellow or under the tongue is yellow or the skin color changes to be yellow, or if your child is of a darker hue, the child just may change in color. So you have to watch for those signs and symptoms.
So you'll know something's wrong. Children all around the world are facing this or are feeling this. What do they do about it? Do they have hepatitis for the rest of their lives? Is this curable?
Well, in some cases, it's not curable because we know that there have been something like 400 cases globally and over 24 liver transplants, meaning that this hepatitis is so severe that it has caused many children's livers to completely burn out and they've required transplants. We've even had 5 deaths right here, and in the United States, we've had over 109 cases. And so the cure for absolute liver failure is liver transplant. So indeed, it's very serious. But I don't want parents to panic. I just want them to really pay attention, watch the signs and symptoms, and be proactive and ask that your pediatrician test your child for hepatitis if you're suspicious.
How old are the children that are affected?
They're young children, definitely less than 16, but anywhere from ages 1 month to 10 years is where we're seeing the majority of the cases. And that's quite scary because if you have kids who don't talk yet, if they're pre-verbal, you really have to be on the lookout for what the symptoms are.
Right. Is there anything we can do as parents to prevent this?
Hygiene is really the only thing that's in our hand. For one, good hand washing. Some of the hepatitis viruses in general can be passed from people not washing their hands when they prepare food, especially after changing a diaper. And then also, if indeed there is a link to COVID-19, we have some studies to show us that being vaccinated could help to prevent some of the post-COVID inflammatory syndromes, such as that MIS-C, multi-system inflammatory syndrome, in children that we've seen earlier.
Okay.
But mainly, protect your children from infection as best you can.
Is it contagious?
The hepatitis in and of itself, if indeed it is from a virus, which we think adenovirus, then absolutely it's contagious. And adenoviruses are common. They typically cause colds, pink eye, a little stomach upset, but the adenoviruses typically don't cause this acute hepatitis unless it's a child who's immunocompromised. But in this case, with this mysterious hepatitis, the kids have been previously well, but the viruses themselves are contagious.
Okay. Dr. Frita, where's your practice? Is it in Atlanta?
It's in Atlanta at Emory Midtown Atlanta Nephrology.
Great. Thank you so much, Dr. I know it's Dr. Fisher, but you go by Dr. Frita, your first name, right?
Yes, Dr. Frita.
Thanks, Dr. Frita. We'll have to have you back on. You're great. Thank you.